Hello everyone, this is Dr. Tofik. Today we are going to discuss the hematology section. Today's topic is leukemia. You'll get a lot of questions from this particular topic, and it is one of the easiest topic you'll get in UKMLA exam. So all of us know leukemia means there will be lots of WBC in our blood, but the thing is they will be non-functional, so they they don't work like a normal WBC. So we have two type of leukemia: acute leukemia and chronic leukemia. Let's just get into the acute leukemia. Acute leukemia has two subdivisions, that is acute lymphoblastic leukemia and acute myeloid leukemia. So in case of acute lymphoblastic leukemia, there is a thing that is called blastic. What does it mean? Blastic means immature. So whenever you'll get blast, it means immature cell, and whenever you get a site, it means it's a mature cell. Okay, so in case of chronic lymphocytic leukemia, there is a word that is site. So site means mature, blast means immature. Okay, so in case of ALL, the prime thing, or you can say in case of leukemia, the age group is really important. You have to memorize the age group. The age group will tell you the diagnosis. Okay, so be really sure about the age. So in case of ALL, the age group will be child. So in other type of leukemia, there will be no child group. So in case one type of leukemia, there will be the age group will be child. So whenever you see a age group of a child, the first thing that will come to your mind, that is the thing is ALL, nothing else. Okay, so in case of diagnosis of leukemia, the initial, that is full blood count. Okay, they'll ask you what will be the initial investigation, that is full blood count. Okay, or what will be the diagnostic investigation, that will be bone marrow aspiration or biopsy. Okay, so this is the diagnostic test. Okay, so in case of full blood cell count, you will get pancytopenia. That means there will be low hemoglobin. That will, the patient will tell you that he is fatigue or she is fatigue. There will be low WBC, so there will be recurrent infection, low platelets. That will be, so patient will just complaining about the bleeding. Okay, so in case of bone marrow aspiration, you'll see numerous blast cell. So what does it the blast cell actually means? As you can see, this is a blast, they are the site. Okay, site. So blast means those are the immature cell. Okay, so in case of acute leukemia, we get blast. In case of chronic leukemia, we get site. Okay, so in case of ALL, we'll get numerous blast cell, and the age group is child, and we'll get pancytopenia. This will diagnose the case of ALL. Now just move on to acute myeloid leukemia. So first thing, that is the age group, not children. They'll be adult, and you'll find rods on blood film. So what does it means? You can see there is a cylinder like thing in there. They are called rods. Okay, so it is diagnostic thing for AML. Whenever you find rods in a blood film, the diagnosis eventually will be AML, nothing else. And there will be pancytopenia, not actually pancytopenia, there will be anemia, there will be low platelets, so the come bleeding. Okay, and whenever you do the bone marrow aspiration, you'll find numerous blast cell. So in case of AML and in case of ALL, you get numerous blast cell. So how will differentiate? By looking at the age group. If they are child, your diagnosis will be ALL. If they are adult, your diagnosis will be AML. Okay, so I have written there You can just take a screenshot. Let's just move on to chronic leukemia. So chronic leukemia, there's a two subdivision: chronic myeloid leukemia and chronic lymphocytic leukemia. So chronic myeloid leukemia, the age group, this is middle age group, that is 40 to 50 years, and you have two members of mnemonics, that is CML means crazy massive large spleen, so you'll get splenomegaly. You can find splenomegaly in ALL also, but you can find commonly splenomegaly in case of CML. So if a person is middle age group and he has splenomegaly and he has raised WBC, a diagnosis will be CML. Okay, so in case of full blood count, you'll get lots of WBC and there will be granulocyte at all stages. What does it mean? Granulocyte means there will be eosinophil, neutrophil, basophil. Okay, you'll see, you can find lots of eosinophil, neutrophil and basophil, but the neutrophil will be predominant. You'll find lots of neutrophil there. But as I'm talking about the chronic, so there will be no blast cell. We find blast cell in case of acute case. In chronic case, we find mature cell. Okay. Another thing, cytogenetics. So you'll get Philadelphia chromosome. So what does it mean? So let's just move on to Philadelphia chromosome. Okay, so this is our normal chromosome 9 and this is our normal chromosome number 22. So there is a translocation of a part of that chromosome. So you can see this portion is coming to this side and that portion coming to this side. So there is a translocation of gene and this is called Philadelphia chromosome. You can find this Philadelphia chromosome in case of CML. This is pathognomic. Okay, let's just move on to CLL. So chronic lymphocytic leukemia, the older age group. Okay, they will be more than, the age will be usually more than 65 years old, and patient will have anemia, recurrent infection, WBC will be high, and one thing you have to remember, CLL, B lymphocyte will be predominant. So in case of CML, we have seen neutrophil will be predominant. In case of CLL, B lymphocyte is predominant. In case of blood smear, you will see mature lymphocyte with smart cell. Okay, mature lymphocyte. So as you are dealing with the chronic case, so you'll find mature cell. And what is smart cell? You can see there. Whenever you prepare a slide, some neutrophil eventually get blast. They're just smashed. So this smashed neutrophil or lymphocyte will call as a smart cell. Okay, so they are the smashed cell. So it is diagnostic for CLL. Let's just move into a box. So before the exam, you don't have that much time to review all of the things. So we have just given you a box. You can just give a just review there, and that will be really easier for you to diagnose all of the leukemia. So in case of ALL, you'll find child group, pancytopenia and blast cell. As those are acute case, you'll get blood cell. What is the differentiating point? In case of AML, you're dealing with the adult. In case of ALL, you are just dealing with the child. Now coming into the chronic case, in case of chronic myeloid leukemia, the age will be M for middle age group. Okay, middle age group, 40 to 50 years old, and crazy massive large spleen. You'll find splenomegaly, loss of cells, WBC will be there, but there will be no blast cell. Okay, you'll find Philadelphia chromosome. In case of CLL, you can find mature lymphocyte, smart cell, and there will be cervical lymphadenopathy. This information is really important. You can find cervical lymphadenopathy in case of CLL, and you are just dealing with the older age group. Okay, and there will be no splenomegaly. Usually there will be no splenomegaly. If you find splenomegaly, either it would be CML or ALL, but the age group, if this is child, the diagnosis will be ALL. If you are just dealing with middle age group, the diagnosis will be CML. Let's just solve some question. from UKMLA part 1. Okay, this is a question. So in our earlier session, we have told you how to get through a question. You don't have that much time to read all the information, so you have to find a clincher. You have to find for the clincher, then you have to diagnose the case. That will save you some time. Okay, so first thing is you have to read the last line first. What are they telling about? They're telling about diagnosis. So they might tell about the investigation, what about the next plan, about the diagnosis. So in this case, we are dealing with the diagnosis. Then you have to read the options. It will give you an idea that which section you are just dealing with. You are just dealing with hematology, cardiology, respiratory, infectious disease, or else. That gives you an idea about the stem. So we are just dealing with hematology. How? A mantle cell lymphoma, infectious lymphocytosis, Waldenstrom macroglobulinemia, acute myeloid leukemia, acute lymphoblastic leukemia. So this is the hematology section. So the last line, what is the single most diagnosis? Then the previous line, a bone marrow biopsy shows numerous blast cell. This is the most important thing, blast cell. Whenever you find a blast cell, you'll just have two things. Either it could be AML, it could be ALL. Then your next plan would be look at the age group. If they're child, the diagnosis will be ALL. If they are adult, the diagnosis will be AML. So is adult 28 years old, sir, will be AML. The answer will be AML. You don't need to read all the information. Okay, like they are just saying middle-aged group person, he has a onset of bone pain, experiencing bleeding from his gum, looking retrospectively he notes decreased energy level, like they are just telling about the fatigue, he feeling dizzy, dyspnea, pale, ecchymosis, blah blah thing, hepatosplenomegaly is noted, hemoglobin is low, WBC is high, platelets are low. Lots of information is given there. You just don't need to see all the information. Blast cell is given, age group is given, diagnosis is AML. Okay, this is the thing. Okay, our next question. You can pause this video right here and you can just set a timer of 1 minute and you can check that can you diagnose this thing within 1 minute. Okay, so let's just move to this thing. They are asking us about the diagnosis. The options are given: AML, ALL, CML, CLL, and Hodgkin lymphoma. Okay. The previous line shows that platelets are low, WBC is low, hemoglobin is low. So we are dealing with pancytopenia. And in the previous line, splenomegaly is noted. And we are just looking at the age group, 5 years. So diagnosis will be nothing else, ALL. So this is the clincher. This is how you can save your time. Okay, our next question shows what is the single most likely diagnosis. Okay, so the previous thing shows platelets high, WBC high, hemoglobin is low, and splenomegaly is seen, massive splenomegaly, and okay, the age is middle age group. So the diagnosis will be AML, nothing else. Sorry, not AML actually, it's CML, crazy massive large spleen. Okay, so this is the thing. Okay, our next question. The next question will be what type of cell you can find the blood smear in this patient. So options are granulocyte without blast cell, myelofibroblast, plasma cell, mature lymphocyte, sickling of cell. Okay, let's just move to the previous line. He complains lethargy. Okay, conjunctiva pale, recurrent infection is given, cervical node is enlarged. This is the information, and the age group is adult, actually older age group. So we have given that if the person is, the age of this person is more than 65 5 years old, and if there is cervical lymphadenopathy, okay, and The diagnosis would be CLL. So we have shown you that we are dealing with the chronic. So chronic means you'll get mature cell. Okay, mature cell. And in case of CLL, we'll get predominance of B lymphocyte. Okay, mature B lymphocyte will be predominant. So this is the thing, mature lymphocyte. So this is the clincher. This is how we can diagnose the thing. Okay. So this is our leukemia section. Our next video will be lymphoma. Hope it will be really helpful for you. Thank you for watching this video. Stay tuned.